Hi, I'm Dr. Roland Hilling-Smith. I'm an interventional cardiologist at St Vincent's Private Hospital, Northside. If you are suffering chest pain that does not resolve quickly, or if you're concerned in any way, it is important you dial 000 and call for an ambulance. It is important that you do not drive yourself to hospital because it may be unsafe to do so. Speak with your GP about seeing an interventional cardiologist. An interventional cardiologist specializes in the diagnostic techniques to assess your chest pain. They may request some tests to determine how likely your chest pain is coming from the heart. If there is a high likelihood that your pain is cardiac, or if you have abnormalities on the test, then your treating specialist may recommend you have an angiogram to assess the heart arteries. Interventional cardiologists are specially trained to perform angiograms and use balloons or stents to fix narrowings or blockages in the heart arteries if necessary. There are various tests that may be required, and your doctor will advise which is the most appropriate for you in your unique situation. Common tests include a heart tracing, often called an ECG, an echocardiogram, a stress test, or a cardiac CT. If there are any abnormalities on these tests, your treating specialist may recommend you have a coronary angiogram procedure to further assess the coronary arteries and the blood supply to your heart. It's often very difficult to tell just from the description of the pain. Most people need to undergo tests to either rule in or rule out cardiac chest pain. Some people experience a heavy, squeezing or crushing sensation, which often radiates or moves up to the neck or down the left arm. It's often accompanied by shortness of breath. Some people experience few or indeed none of these symptoms and still end up having cardiac chest pain. Remember, if you're suffering from chest pain and it doesn't resolve quickly, or if you're concerned in any way, then it's important to dial 000 and call for an ambulance.